Alabama started its reopening on May 1st. Since then, COVID-19 case numbers have been climbing, hitting a new daily high earlier this week. Hospital ICUs are becoming scarce in some of the state's biggest cities, including the state capital, Montgomery, where Stephen Reed is the mayor. Mayor Reed, thank you for joining us tonight. Give us an update on what the cases are like and the hospitalizations in your city.
Well, unfortunately, cases are still going up at this moment, and our ICU beds are still running low. So we've improved marginally, but not enough to get us out of this crisis moment. And essentially, this is a place where we can manage it, but we can't sustain the trend that we're on right now.
Do you think that Alabama was too quick to reopen?
I do. I think we tried to accelerate the process, and I think, from our standpoint, that has had a negative impact on our progress. And I think that's why we've regressed some, and we've seen a 300% increase in cases month over month after going the first 3 weeks of this month at a 40% clip. And when you think about that and the impact that it has on businesses, where 40% of hourly employees have decreased their number of hours in working in small businesses, it has a tremendous economic impact, and it's one that has a ripple effect throughout this community.
As far as managing the health crisis, Mayor, you did have more time than, say, New York did to prepare. Had you been doing that, and is that helping you right now?
Oh, absolutely. We were very proactive when we first started hearing about the coronavirus. We took this very seriously. We went out and we made all the preparations that we could in working with our healthcare partners in this community. So we are in a place where we can deal with some of the challenges that we have right now, but we can't sustain it. We see ourselves approaching a cliff, and we just want to make sure the public is aware in this community what's at stake here and what we have to do in order to get back on the right track. And that means putting on our masks when we go out in public, staying home as often as we can, and following the CDC guidelines.
Are folks in Montgomery doing that?
I think by and large they are. We've had a great collective response in this community over the last few months. We put together a small business recovery fund, recovertogethermgm.com for our small businesses. We put together community impact task forces between our public and private partnerships and nonprofits. So we're working together to overcome this. Unfortunately, I think when we reopened the economy, many people celebrated prematurely and thought we had won the battle, when the fact is that we're still in the middle of it and we have more work to do.
So, Mr. Mayor, is there anything you can do to roll back the reopening or at least enforce the social distancing measures more to stop the trend?
We're looking at mandating masks in the community in this city because we've been encouraging that, and we have not wanted to, start another ordinance or really implement that. But we're at a point right now where I think we have to do that for the safety of our public. And we're in communication with our governor's office as well about maybe looking at doing a shelter in place regionally and trying to assess this damage that we have from a regional perspective as opposed to a statewide perspective, so that parts of the state that are doing well as it relates to their COVID cases can remain open and continue their progress. But some of us who are hotspots right now can maybe slow things down just a little bit in order to get back on our feet.
How are the hospitals holding up? How much capacity is there in the ICU right now?
There's less than 4% capacity right now in our ICU. Across this entire region. Our medical staffs are exhausted physically and mentally. We're running into challenges as it relates to PPEs as well. So we're not at a point where we can really relax, where we can take a look at things that aren't working here. What we have to do is to stay disciplined in our approach for our healthcare professionals, for our first responders, and for those who may be asymptomatic, but may be impacting and infecting others because of their behavior. So we're trying to make sure we work with our hospital partners in this community to do the best we can to make the public aware of where we are and what they can do to help us by their own personal actions and taking accountability for what they do and how they move about.